Dr. Jean Watson, let me just say what a pleasure it is to speak with you today. We are somewhat close to you. My name is Chelsea Pitcher, and I'm here in Utah. My colleague, Teresa Ohl, she is in neighboring Montana. And, of course, we have our viewers in the audience. Hello, everyone. And thank you, Dr. Watson, for your time. Let's quickly get to our questions for you. Can you just tell us a little bit about yourself?
Okay, hello, my name is Jean Watson. You can go ahead and call me Jean. Well, I was born in West Virginia, and I'd rather not say what year, if you all can understand that. And I graduated with my Bachelor's of Science in Nursing from the University of Colorado in 1964, as well as my Master's in Psychiatric Mental Health Nursing, and my PhD in Educational Psychology and Counseling in 1973. So I've been around for a while.
Yeah, I guess. So what's your view of nursing itself and the focus that you have on nursing?
Well, nursing is a human science. It consists of knowledge, thought, values, philosophy, commitment, and action with a passion in human care transactions. I think that the focus of nursing should be transpersonal caring relationship and a moral commitment to protect and enhance human dignity. Also, it should allow human beings to determine and find their own meanings.
So, Mrs. Watson, you, of course, came up with the theory of transpersonal caring, which is also called theory of human caring. Tell us a little bit about that theory.
Well, my theory of human caring, it emphasizes on the humanistic aspects of nursing in combination with scientific knowledge. The theory of human caring is designed to bring meaning and focus to nursing as a distinct health profession. Today, my theory is one of the few theories available that incorporates both the patient and the nurse.
Well, Mrs. Watson, can you tell us what transpersonal caring is and the goals for using this type of caring?
Sure. First, transpersonal means going beyond one's own ego and to reach a deeper spiritual connection while comforting your patient. The transpersonal relationship depends on, number one, a commitment from the nurse to enhance and protect the human dignity. And number two, the awareness from the nurse that they have the ability to heal. Number three, the nurse must go beyond the objective role. The goals of a transpersonal caring relationship are to preserve and protect a person's humanity and dignity, to preserve a patient's spirit, and to ensure that the patient does not just become an object. The relationship itself also allows the nurse and the patient to mutually seek out meaning and in turn lead to a transcendence of suffering. And
Dr. Watson, curative, that's a term that you came up with. What exactly does curative mean?
Oh, curative. Yes, I did come up with that. Curative, it's my philosophy and theory of human caring. It aims at the caring process that helps to attain or maintain health, or to die a peaceful death. It differs from curative, which curative aims at curing a patient of diseases. Curative factors include spiritual, emotional, and human caregiving factors that are added and meshed together with clinical factors also. Some examples I could give you would be showing kindness, concern, and love for yourself and others, enabling or sustaining faith and hope in the patient's families.
Oh, that's great. So, Mrs. Watson, in your theory of human caring, you talk about 10 primary curative factors that support your theory. Can you tell us what those factors are and just a little bit about each one?
I sure can. Well, first of all, my theory, it consists of 10 curative factors, as you have mentioned. And the first three curative factors form the philosophical foundation for the science of caring. The remaining 7, those factors of human altruistic system of values begins developmentally at an early age with values shared with the parents. And then we have the installation of faith and hope that's essential to both the curative and the curative process. We go on to the cultivation of sensitivity to oneself and to others, and they explore the needs of the nurse to to begin to feel an emotion and as it presents itself. Then the development of helping and trusting relationship. That's the strongest tool of communication with your patient, and it establishes a very good rapport and shows your caringness for your patient and their family. Go on to the promotion acceptance of the expression of both positive and negative feelings that helps us to understand the behaviors. The systematic use of scientific problem-solving methods it allows us for control and prediction. It permits self-correction. The science of caring should not always be neutral or objective. Going on to the promotion of interpersonal teaching and learning, it helps us to understand the person's perception of the situation. It also assists the nurses to prepare a cognitive plan. The provision for supportive and protective or corrective mental, physical, socio-cultural, and spiritual environment. That's also important. The assistance with gratification of human needs, it's also based on a hierarchy of needs similar to that of Maslow's. The allowance for existential phenomenological forces, also very important. I could go on and on, but I don't want to bore any of you with that.
Oh, Dr. Watson, we could never be bored. Theories, they all have strengths and weaknesses. Can you tell me some of the strengths and weaknesses of your theory?
Well, it is strong in the fact that this theory places client in the context of the family and the community and the culture. It places the client as a focus rather than the technology. However, some of the limitations are that the biophysical needs of the individual are given less importance. The 10 character factors primarily delineate the psychosocial needs of the person, and there should be some further research to apply in our daily nursing practice.
Well, that sounds great. You've done an awful lot of work on your theory. So if you could just leave us with a quote or two, we're going to wrap up here. But if you could just leave us with a quote for the nurses, what would it be?
Let's just keep it simple and sweet and short and to the point. Caring is the essence of nursing. If you take anything away from this interview, just remember, caring is the essence of nursing. Without caring, you can always be curative, but unless you care, you cannot be curative.
Thank you, Dr. Watson, for your time.
Thank you.
No problem. Thank you.